Hello and welcome. Today, we're going to talk about something that a lot of women go through but isn't always talked about openly. The changes that can happen to your body after having a baby or just over time. We're going to dive deep into a medical procedure called vaginal plication, and we'll break down what it is, why it's done, and what you can expect. Does this question hit home for you? For so many women, this feeling is a very real and honestly a pretty frustrating concern. It's a change that can mess with your comfort, your confidence, and even your sex life. If you're nodding along, I just want you to know you are definitely not alone, and there are real medical reasons for this. And more importantly, solutions. So here's our game plan. We've got 5 parts. We'll start by understanding what vaginal laxity even is. Then we'll look at all the treatment options out there. After that, we'll walk through the actual procedure, talk about recovery, and finally, what life looks like in the long run.
All right, let's jump right into part 1. We've got to start with the basics, right? What exactly is vaginal laxity and what causes it to happen in the first place? Figuring out the what and why is the first step to understanding the fix.
Okay, so this procedure, vaginal plication, is the surgical answer to that laxity. And the key words here are muscular and fascial support structures. This is so important. We're not just talking about a cosmetic tightening of the skin. Nope. This is a deep structural repair. It's like rebuilding the internal scaffolding to give everything better tone and support from the inside out. Now, you might have heard this procedure called a few different things, which can be confusing. It's sometimes called a posterior colporrhaphy, or you might hear more general terms like vaginoplasty or pelvic floor tightening. Just good to know these names so you know everyone's talking about the same thing. So what are the signs we're talking about? Well, it can be a mix of physical and functional stuff. A lot of women just describe it as a general loose feeling. This can lead to less friction during sex for both partners. Other really common things are air getting trapped, sometimes called vaginal wind, or even having trouble keeping a tampon in place. It's all these things that the procedure really aims to fix. So what's behind all this? Well, the number one cause, not surprisingly, is vaginal childbirth. And that's especially true if you've had more than one baby or a larger baby. But that's not the whole story. The natural aging process, menopause, just having weaker pelvic floor muscles, even things like obesity and your genetics can play a role in weakening those crucial support tissues. Okay, now that we have a good grip on the problem, let's move on. What are the options on the table? What can you actually do about it? You've basically got 2 paths you can go down, non-surgical and surgical. For milder cases, doctors will almost always start with non-surgical stuff. We're talking about things like pelvic floor physio, your Kegels, or maybe estrogen therapy. But here's the catch. While those things can definitely help, they often can't fix a major physical separation of the muscles underneath. And that's really where surgery starts to become the main option. All right, let's pull back the curtain and look at the surgery itself. I know it can sound intimidating, but when you break it down step by step, it becomes a lot less mysterious. It's actually a very methodical process. So first, the surgeon makes an incision inside the vagina, which is great because it means no visible scars on the outside. This lets them get to those weakened support tissues. Then they use sutures to basically fold and tighten up those underlying muscles and fascia. If there's any extra stretched out vaginal lining, they'll trim that away. And finally, everything is closed up with stitches that just dissolve on their own over time. Okay, surgery's done. Now what? This next part, recovery and risks, is absolutely essential to understand. You've got to have a realistic picture of what comes next. Let's start with the positive, right? The whole point of the procedure, we're talking about a real functional improvement. Better vaginal tightness, which usually means more friction during intercourse and better sexual satisfaction. It can also fix some minor bulging, and again, a huge plus, no outside scars. And of course, with any surgery, we have to talk about risks. It's so important to know what's common versus what's rare. So you can pretty much expect some swelling, bruising, and discomfort. That's normal. Constipation can also be an issue right after. Then there are the less common but more serious risks like infection, a wound not healing right, or even over-tightening. These are the things you'll want to talk through in detail with your surgeon. So what does this recovery journey actually look like? Well, right away, you'll feel some pressure and swelling. But after about 2 or 3 weeks, the worst of that swelling should go down. The big milestone is usually around 6 to 8 weeks. That's when most people get the green light to go back to everything, heavy lifting, exercise, and intercourse. And then, by about 8 to 12 weeks, patients usually start to notice that real improvement in sexual function. And this brings us to our last section, the long term. What is life really like months or even years down the road after this procedure? The great news is that, for most people, the results are really long-lasting. Patient satisfaction is generally reported as being very high. Now, there is one big caveat. If you have another baby via vaginal delivery, it could stretch out the tissues again and undo some of the repair. That's just something to keep in mind. Also, maintaining a healthy lifestyle is key to helping those results last. This quote from the medical literature really sums it all up perfectly. It's considered a safe and effective solution, but it's specifically for women who are having symptoms. It's affecting their life and for whom those non-surgical treatments just haven't been enough. So we end with a question for you. Now that you have all this information, is it maybe time to start a conversation with your doctor? We really hope this explainer has armed you with the clear, solid knowledge you need to feel confident in making the best choices for your own health.